各位傳媒朋友
Friends of the media, good morning. Thank you for coming to the press conference on our fight against the epidemic. The Chief Executive will say a few words and then she'll take questions from the floor. Please keep your distance in the light of the epidemic. Chief Executive will speak now. Good morning, members of the media and the public. Today, together with the Secretary for Development and Secretary for Security, we are here to give you an account on an important aspect of our fight against the epidemic. Our strategy is early identification, early isolation, and early treatment. So an important aspect is, of course, early isolation. In our fight against communicable diseases, it's important that we isolate those who've been infected so they are taken out of their home and the workplace. That will help to prevent the spread of the disease. This is also an effective tool to cut the transmission chain in the community. Of course, in any places, it's not possible to have completely effective early isolation and early identification and early isolation. That's why we need various social distancing measures to minimize the chance of people coming into contact and being infected. In the past 2 years, we have adopted very stringent public health protection measures. For every infection case, the Center for Health Protection will do contact tracing to identify close contacts. And also they will go further to identify close contacts of close contacts. And that's why for close contacts and the secondary close contacts, they have to be isolated when they're found. Now, usually for the infected, even if they have just mild symptoms, they will be sent into isolation center facilities. As for close contacts and secondary close contacts, they are sent to quarantine facilities. Well, whether it's isolation or quarantine, that's based on the law. That's CAP 599A, Prevention and Control of Disease regulation. So we could issue isolation or quarantine orders. Now, if it's a close contact, we issue a quarantine order, and for an infected person, then we issue an isolation order. So whether we arrange for isolation or quarantine, of course, we need to have the facilities and we need manpower to operate these facilities, and that is the focus of our briefing today. Now, the epidemic has been around for about 2 years and so, and we have done much in terms of construction. For the community isolation facilities, we started from scratch. And so we started with nothing. Now we have some isolation facilities, and then we're building even more. Now I'm sure you are familiar with the Lei Yu Moon Holiday Camp, Foten Chongyang Estate, or Penny's Bay in Lantau Islands. These were isolation facilities that we deployed when we had few cases. Our quarantine and isolation work was done relatively orderly. And for isolation facilities, we focused on the hospital authority, because in the past, when we did not have too many cases, the most cautious approach would be put all infected persons in hospital facilities. And there are some 1,900 first tier and second tier isolation beds in the hospital authority. And then in February last year, the central authorities helped us to build another isolation facilities at Penny's Bay with 820 beds. And then for quarantine facilities, in the early stage of the epidemic, we converted the Lei Yu Moon Holiday Camp, and also we converted phases 1 to 4 of the Penny's Bay facility. So we have a total of 3,700 units. But then in a fifth way, we're seeing exponential growth in the number of cases, and we have adopted a number of measures in parallel. First, we have triage arrangement. We're also building more, providing more facilities. In terms of triaging, there are several concrete tasks we're doing. Now, for those, apart from those with needs, we allow close contacts to isolate at home. Because before this wave, in the past 2 years, we put close contacts in Penny's Bay for isolation. But then for a month now, we have allowed home isolation for close contacts. We also give them support while in isolation. The second task we're doing is to do triaging for those who've been infected. So some of the infected persons are sent to facilities other than hospitals. Of course, for those in serious condition or with high risk, they should be kept in hospitals for treatment. But then, as you know, with Omicron, there is a special feature. Many who've been infected are either asymptomatic or have only mild symptoms. So that's why we need to triage a large number of people to community isolation facilities. And then hospitals could focus on the infected who have high risk. And then hopefully we could reduce the number of serious cases and death cases. Now, I've given a detailed explanation yesterday on that. Now, to facilitate triaging, the Center for Health Protection prepared an electronic form. We asked people to declare their own family condition and living condition, so that there could be better triaging. The Security Bureau and the Fire Services Departments have also put in place new arrangement for the infected to ask to go to these isolation facilities. And then the Center for Health Protection has also revised the criteria for the completion of quarantine or isolation. Now, if people have had 2 doses of vaccine on day 6 and day 7, if their rapid antigen test results are negative, then they could go back to normal. They'll be out of quarantine or isolation. And then for isolation facilities, there are 5 sources of provision of these facilities. The first type, of course, would be like holiday camps, like the Lei Mun holiday camp. Actually, we've only have 1 camp just now with 352 rooms. And then we could also build new community isolation facilities on vacant sites. Now, all along, we've relied on phases 1 to 4 of the Penny's Bay facilities, which provide 3,400 units. And so when we made a request to the central authorities for assistance, one of the requests was for them to help us build more purpose-built community isolation facilities on vacant sites. And now we have 9 sites. 1 site is at Lok Ma Chau Loop, and 8 sites are at various locations across the territory. In a moment, the Secretary for Development will tell you more. Well, why do I have to, talk about Penny's Bay and the other 8 sites separately? Because for the other 8 sites, the construction model is very similar. But then for the Lok Ma Chau Loop, because it's close to Shenzhen, and we need to enhance our capacity with speed. So the mainland authorities send contractors from mainland to help us build the facilities on that site. And of course, on the same site, there's another emergency hospital being built. And this site provides largest source of units. And after all these 9 sites are actually completed, we would have an additional 50,000 units or so. The third source of supply would be a completed public housing estate without population intake yet. You remember in the early stage of the epidemic, we used the Chongyang estate in Fo Tan as isolation facilities, and then later on we handed those units to those who've been allocated units. And now we have 3 blocks of public housing estate that will give us 3,400 units for isolation purpose. And then the fourth source of supply would be to pay hotels to use their rooms. You might recall that I had a video conference with the hotel sector. There was positive response from them. Now there are about 30 hotels that would join the community isolation facilities program. About 18 hotels are in operation, half of those who've indicated they wish to do so. And when all 30 hotels are able to provide service, then that should provide us with 15,000 hotel rooms for community isolation purpose. And then the last source of supply would be for us to use 2 large-scale transitional housing projects. There are a total of 2,500 units. And the date of completion is close to when we would need these facilities in this wave of the epidemic. So that's why we'll be using those units for isolation purpose first. And altogether, we will have 20 times more in terms of isolation capacity after all these projects are in place. Now, for the Lei Moon Holiday Camp and the Penny's Bay facilities, as I mentioned, there are about 3,700 units there. So we had 2 sources before, and now we have 5 sources of supply, and all these facilities are completed, and we will have over 70,000 units, all beds. Because in some facilities, the capacity is counted by the number of beds. In a moment, the Secretary for Security will give you an account on the occupancy situation with these isolation units or beds. And finally, I would like to say that we have several hundred times more cases each day than the number of cases in previous peaks. So when we arrange for people to go to isolation facilities or give support to those in home isolation and take care of others in community isolation facilities, of course, there is room for improvement. I and the SL government will continue to work very hard. We hope that after people are infected, they could be put into isolation soon and put their minds at ease. Our assessment is that people can leave 5 days after going into isolation facilities because of the revised criteria for completion of quarantine or isolation. Now, of course, with any anti-epidemic effort, we need the support of the public. So here we would like to make an appeal to the public. If you have been infected, please follow the risk assessment criteria of the health authorities, or have regard to your own condition. If you believe you need to go into isolation facilities, we would help you go into these facilities in an orderly manner, because that will help to reduce the risk of transmitting the disease to your family members, or for the transmission of the disease in the community leading to another outbreak. Now, I would like to say that we keep taking stock of experience and learning from the experience in this fifth wave of epidemic for isolation of close contacts and so on. What we're doing now would help us to prevent outbreaks in future if we adopt the same approach. Now, I will invite the Secretary for Development to give you the latest progress on the construction projects, and then the Secretary of Security will tell you more about the management of these facilities. Thank you.
Thank you, Chief Executive, and good morning, media friends. Now, I will talk about sites, the 8 sites besides the River Loop site where the Chinese construction company will be responsible for building the isolation facilities. The total size is 8.6 hectare in size, and upon completion, there will be an additional 40,000 beds or units. They will be delivered in 2 phases. For the 6 sites which we are familiar with, including Shantin and Chengyi, they have been delivered and have commenced operation. In Chengyi, the 3,900 beds were delivered on the 1st of March, like the Chief Executive said. It shows the staunch support from our nation. They were completed in 7 days. For the Shantin site, 2,800 beds were delivered in early March. So the total number provided is some 6,800. In the near future, for Fanlang, the Hong Kong Zhuhai Macau Bridge Artificial Island, as well as the Hong Shui Kiu, the 3 sites will commence operation. Starting the week, starting 21st of March, the site at Tam Mei will also commence operation. It means that in March, there will be an additional 14,000 isolation beds which will be delivered. Now let me be more precise. Counting Shantin and Qingyi in March, a total of some 20,000 beds will be delivered from these 6 sites. That is Shantin and Qingyi, 6,000 beds, as well as Fanling, Hong Shui Kiu, Tam Mei, and the Hong Kong Zhuhai Macau Bridge Artificial Island. Altogether, 20,000 beds delivered in March. Further down the road, the Penny's Bay, as well as the Kai Tak former runway precinct, those are major sites. Altogether, 20,000 beds will be delivered in batches in May. And let me share with you some statistics. Like I said, the 6 community isolation facilities delivered in March. At peak, there were 15,000 workers working at the sites. Half of the workers are Hong Kong workers, half from the mainland. The containers were built in the mainland. So we have 7,000 Hong Kong workers and 7,000 mainland workers working together in these projects. At the peak, we have deployed over 620 major construction machineries at the site. At the peaks, every day we have 150 vehicle trips at the site. Later on, we also have marine. We also have vessels delivering construction materials. 6 vessels trips per day at peaks. Now, I would like to express our thanks to the nation's support. I'm grateful for the staunch support from the central people's government, as well as the coordination efforts of the HKMAO. I also thank the China State Construction International Holdings Limited for overcoming difficulties, bringing together Hong Kong workers and mainland workers to work around the clock for these projects. The Hong Kong SAR government will strive to provide the support and coordination in these projects. We believe that with our united efforts, Hong Kong can overcome this fight against the epidemic. Secretary for Security. Thank you, Chief Executive, members of the public, media friends, good morning. Community isolation facilities are provided for COVID-19 patients with mild or no symptoms to cut a transmission chain in the communities. So far, we have 23 community isolation facilities covering different types of facilities, including a Penny's Bay, isolation hotels, public housing estates, as well as the Qingyi Community Isolation Facility, which was built with the help of the Central People's Government, as well as the Shantin facility, which has been commenced recently. Altogether, 18,800 beds or rooms were provided. As of last night, the occupancy rate has exceeded 40%. In terms of isolation hotels, hotel management is implemented in these facilities. We adopt a human-centric approach to run these facilities. The staff members would communicate with the residents to provide people-based support. And with the support of the nation, the facilities were built up to standard. There are shared bathrooms and toilets. It's like at the AWE. To take care of different needs of the residents, we would provide vegetable meals as well as meals suitable for Islamic people, as well as providing thorough disinfection. We are making sure that there is a thorough disinfection for toilets and enough cleansing soaps in toilets. We've also received a lot of support from community stakeholders as well as telecommunication service providers. Special arrangements have been provided for residents. For example, free newspapers, as well as free access to online entertainment platforms, toys for children. There are also 5G network coverage with free local data. We've also received a lot of contribution from the community. We are striving to enhance our service as these centers to offer comfort to the residents. The Security Bureau has been enhancing its speed to arrange for patients to check into these facilities. The FSD has dedicated a hotline to take calls from patients with no or mild symptoms to check into these facilities voluntarily. The response is satisfactory. As of this morning, 19,000 such calls have been received. However, for more than half of the callers, full information was not provided, and also some were not requests to check into facilities, but rather to give us their views. And there are also callers which do not fulfill the criteria for checking into the facilities. In the end, 1,700 cases were arranged to check into the facilities, and also 300 are pending. We are receiving thousands of calls each day. To facilitate convenience for infected ethnic minorities, especially a foreign domestic helper, the information package provided by the FSD has been translated into different languages to provide access to ethnic minorities. And also through the Labor Welfare Department, as well as embassies, as well as NGOs, we are arranging for infected foreign domestic helpers to check into isolation facilities as soon as possible, as well as relaying the information to employment agencies and employers to make them aware of the service, so that FDH infected can be isolated as soon as possible. Now, when an isolation order is issued by the Department of Health to request patients to check into isolation facilities, this is a document carrying legal effect. The public has to follow the order. It is not up to the patients to decide whether to check into the facility. Otherwise, it would be against the law. We would arrange for infected patients to check into isolation facilities as soon as possible. Now, with the ramped up capacity, we hope that we can put more infected persons into isolation facilities to secure the protect the health of others. For those who refuse to be check into the isolation facilities, it would be a public order offence, liable for imprisonment and a fine. If residents have flouted the isolation requirements, they would be liable to a fine of $5,000 and 6 months imprisonment. We will help we will deploy law enforcement agencies to enforce the order. Now, the situation is serious. I appeal to all the public to work with our civil servants to fight against the epidemic. Thank you.
Floor is now open to questions. If you want to ask questions, please raise your hand. And when you're asked to ask question, please first identify the agency you represent and then use the microphone to ask your questions. We have many reporters here, so please limit yourself to just 2 questions each. The gentleman in brown at the back. Good morning. I'm from Hong Kong 01. Can you speak up, please? I'm from Hong Kong 01. A number of questions. The first one. The Hong Kong 01 received an open letter by those in charge of the infection control to the chief executive. Now, it said that there are not enough supplies each day. Only 20% of supplies were distributed each day. And they say there is no efficiency in the government and there is no one who could actually lead the whole effort. And different departments are just doing their own things in the prevention and control of the epidemic. So what is your response to that? And yesterday, second question, yesterday, there's an emergency alert issued by the government. Many in the community said that they panicked. And some said it's like a crying wolf is a crying wolf case, and so they just switch off the alerts altogether. So what are the criteria for issuing such alerts, and why did you choose to issue that alert yesterday? The alert was about the Queen Elizabeth Hospital, so why did you choose to send that message as an alert? And for those who have switched off the alert functions on their phones, what would you say to them? Should they turn on the function again so they could continue to receive such messages from the government? Thank you for your 2 questions. I have read this open letter passed on to me by your agency. Of course, that's an anonymous letter. It said that in the office for the Government Chief Information Officer, there's this distribution of kits against the epidemic. Now, of course, when we design any policies or measures in an emergency, we cannot do so with as much care as we would in normal times. And then we need to do a risk assessment. And if someone needs to go into isolation, we issue an isolation order and that one moves into an isolation center facilities. But if the person is suitable for home isolation, we would like to be able to send him an anti-epidemic pack at the first instance. And there'll be information on our anti-epidemic effort, for example, their hotlines, if they don't feel well, where the dedicated clinics are located, how they could make appointments, and how they arrange dedicated transport. And then we would also give them rapid antigen test kits. And later on, we're going to include proprietary Chinese medicine and thermometers and so on. But then we're talking about a huge number. I hope you understand that. We're dealing with a huge number of cases. Yesterday, for instance, there are over 50,000 cases, including the self-reported RAT results. And then we're talking about over 50,000 people at home, and we need to send them the packs, and so it's a major exercise. In any case, we are doing our very best. I think it was the day before yesterday we managed to approach 20,000. There were over 20,000 infected persons, but we will be sending out more such anti-epidemic packs because there are family members as well. So it's possible that we need to send out 2 or 3 packs in one to one household, and we have mobilized many people actually. The Secretary for Innovation and Technology would be visiting the ICAC later today, and you may ask, what has ICAC to do with our anti-epidemic effort? It's because we're mobilizing everyone in the government. So the ICAC's headquarters in North Point has become the place where our logistic contractors go to collect addresses and the anti-epidemic packs, and then the contractors will deliver these packs across the territory. Now, the open letter said that we are working in silos. Each department is doing its own things, and they're not working really hard, and it does not really hold water. In fact, when it comes to the delivery of anti-epidemic packs, we have mobilized the 6 biggest logistics operators in Hong Kong. Some are really famous. You know they are recent startups. But then we're talking about a huge quantity of packs to be delivered, and that's why we're not able to fully comply with the indicators. And I hope you understand that. And for those who are affected, if they don't receive the packs at the first instance, we ask for their understanding, because we're talking about huge quantity. It's no longer just about efficiency. In fact, with any cities, if they have to cope with this amount of work in such a short space of time, it far exceeds the capacity. Now, with testing, if we want to boost testing capacity, we could borrow such capacity from the mainland, and we want to build more community isolation facilities, we could ask for support from the mainland. The Secretary for Development just told you there are some 7,000 workers on the mainland working for Hong Kong. But when it comes to the delivery of packs, well, we can't really borrow resources from the mainland, so we ask for understanding. Your second question is about the emergency alert sent out yesterday. Well, let me give you the background. In 2020, the Legislative Council approved this system. At the time, it was under the anti-epidemic fund that we applied for the setting up of an emergency alert system. Since the system was put in place, we've never put it to use. The purpose of the system is that in emergencies, the government could send out real-time information to the public. So that's why we need to set up this emergency alert system. Before we had this system, if the government needed to send out emergency information, we relied on the SMS system. I'm sure you've received many such short messages. But then with short messaging service, SMS, there are certain inadequacies. Now, we need to send the short messages to all mobile phone users, and it would take a long time. At the time, the estimate was about 4 hours or more before we could send the same message in batches to mobile phone owners. And for mobile phone users who use just the disposable or cards and SIM cards, it can't be done. That's why we have made reference to the practice in Japan and in the US and so on, and that's why we set up this emergency alert system. We use broadcasting technology so we could issue this emergency messages to all mobile phone users. At the first instance, we have some 24 million mobile phone holders, and they will all be receiving the message at the same time, and that's the whole purpose of setting up this system. And then you might ask, when would we choose to activate the system? Well, of course, it's a matter of degree. Yesterday, I believe, is appropriate for us to use the system. I don't think anyone will question that we are now in a case of emergency. It's a public health emergency. Otherwise, there won't be so many emergency regulations in force. And I'm also leading this high-level steering committee and command center in this fight against the epidemic. So why did we send out the alert? Because the Queen Elizabeth Hospital is the leading hospital in the Kowloon Central cluster. It has the busiest accident emergency department out of all the 17 hospitals in 7 hospital clusters. It probably handles some 10% of people going to A&D department. And then not just people from Kowloon Central would go to Queen Elizabeth Hospital. Even people living in the New Territories, because the QE has a long history, so people would actually travel from the New Territories to go to the Queen Elizabeth Hospital's accident emergency department. They might take a taxi or ask someone to send them there. So if we're going to convert QEH into a designated COVID hospital, we need the support of the Fire Services Department. If people call 999, ambulances will send patients to hospitals other than the Queen Elizabeth hospitals. But then there are others who may not know about this arrangement, and they may still go on their own to the QE for accident emergency service. And as we announced yesterday, the QE is no longer taking in non-COVID patients. So that's why there is need to send out this emergency message. Now, in the Finance Committee paper, when we applied for funding for this system, that's one of the reasons we gave. Of course, there will be different responses to first-time use of the system. You passed on the response of some people, but then I've also read on other platforms that there are people saying that, oh, this is good, so there is this system, and then the government can inform us in future. Of course, phone suddenly sounded, or there's a vibration of the phone. People, for some 10 seconds, some people may be alarmed. But anyway, it's not just for public health emergency. There could be other emergencies. Of course, I don't want to see these emergencies. We have the Secretary for Security sitting next to me, but sometimes there may be emergencies in terms of law and order. Anyway, yesterday we have tried this system, sending out an alert on the Queen Elizabeth Hospital, and in future if there's a need to send out another emergency message on other issues, people will know what it's about. So that's my detailed response to what happened yesterday. At the back, the lady in grey.
I'm from Bloomberg News. Can I please ask how long does the Hong Kong government plan to keep the flight bans, given that the number of imported cases is only a fraction of the local cases we're seeing in Hong Kong? And my second question is about the compulsory universal testing, which is still under planning. Can you talk more about whether a lockdown is going to be used for the testing, when and if it's going to be carried out? And if not, can you say what would be a limited lockdown looks like? Thank you.
First of all, I hope our reporters and members of the public will appreciate the purpose of having this daily high-level press conferences is to focus on issues which are of public interest and concern, so that we could disseminate the accurate information in a more systematic manner. For issues that I have addressed many, many times, I have no new information to provide. It is unnecessarily taking up the time of this limited session of press conference. So I have nothing to add on the compulsory universal testing, which I have answered extensively on previous occasions, including yesterday. But on your first question, I understand that a lot of people are very anxious to know when we will resume flights from the 9 place-specific places where flights have been suspended for quite some time, especially for Hong Kong people who are keen to come back, and also for international business and so on. But at the moment, Hong Kong is right at the most critical juncture of fighting the epidemic. In fact, at least one country has put us on the highest level of alert, forewarning their citizens not to come to Hong Kong. So this is not the time to immediately lift the ban, and as a result, a lot of people will rush to come back. And inevitably, among some of those people, there will be infected cases. There may even be critically ill cases arising from the returns, and that will add a lot of pressure to our public hospital system. You may still remember there was one flight recently, on one single flight, we have over 20 infected cases upon arrival. And being a humane government, we have to look after those cases. I need to transport those cases either into a hospital or into the isolation facility. But Hong Kong is already under extreme stress right now. I can't even fulfill the pledge to my people to send them health kits and to arrange for them to go into isolation. So I have to protect my health colleagues, especially in the front line. At this moment, it is not the time to add more pressure to their work. But I can tell you that we have plans after controlling this fifth wave, and preferably having a compulsory universal test that will enable us to eliminate any remaining infections in society, we will certainly have plans or a pathway to open up Hong Kong again for our own people and for the international travel.
第三位記者提問。
The lady in white. Good morning. I'm from Cable News. Now, the emergency alert yesterday was Mrs. Lam shocked because there were some members of the public who were so shocked that they had to turn off the phone. Now, you said the alert would be sent out at emergencies. However, at the 4:30 press briefing, the arrangements has already been announced. It was also announced earlier at the day. So why was there a need to use the EAS? And what is the criteria for using the emergency alert system? Which department is responsible for that? Now today, Mrs. Lam, you are wearing the mask. So did you yesterday? You said you want to get your emotion across to the members of the public without a mask on. But you are wearing the mask these 2 days. So are you worried that your emotion cannot get across and the members of the public cannot feel the seriousness of the situation? 2 questions, please. Now, for your second question, every day I'm doing a risk assessment. So in answering your question, I base on a risk assessment. As the chief executive, I'm making the best judgment. Now, for your first question, I have answered it in length. You asked specifically the criteria for invoking the EAS. I've told you when the system was designed is to issue emergency alerts, to issue simultaneous alerts to all the public. I don't believe that all members of the public would pay attention to the press briefings. We had 2 press conferences mentioning the arrangements for converting Queen Elizabeth East Hospital to COVID hospital. No non-COVID patients would be taken in except for pregnant women or those in a critical condition. That's the message. Of course, I don't want the public to turn off the system. I don't know whether you can do that, but if you do, when everyone in Hong Kong receives the message, you won't be able to receive the alert. It is not good for you. Of course, it caught some people off guard. However, it is the same for all emergencies. You don't know when you will receive an alert or a vibration on your phone to receive the alert. I have received the alert as well. I was working and then the phone alerted me. So this is something that is worth doing, so that we can disseminate information to all members of the public. Another question, the lady in blue. Good morning, I'm from Ta Kung Pao. Now, it is like fighting a war against the epidemic. Now, the central government is steering our efforts. Now, are we able to cope with the needs in this war? The central government has also mentioned that the Hong Kong SAR must take up the main responsibility in the fight. So would you own up to this responsibility? How do you think you are performing? And also in the 5th wave, the situation is very serious. It exceeded our capacity. Now the situation has lingered, the epidemic has lingered for 2 years. Should we reflect on our performance? Is there any shortcomings? Since January 2020, our work has been steered from a high level. But the system was also put in place back in 2003 when we had SARS. At that time, the then chief executive or the then secretary for Food and Health did not have a full grasp of the effort against the epidemic. You can see that from the report. So from then on, we have been putting in place different mechanisms. We have a 3-level emergency response system. The lowest level is responsible by the Secretary for Food and Health and the Director for Health, and then the second tier would be led by the Secretary of Food and Health, and for the top level, it would be led by the Chief Executive. Now, since the epidemic began, we have elevated the situation to the top tier level. The Command and Steering Committee is chaired by the Chief Executive. We know that we can't just have empty words. We have to take actions. And for actions, we need a high-level steering. So we have a steering committee and a command center to steer our efforts. It has been put in place for 2 years. In the past 2 years, we have seen very good results. Recently, Professor Liang Man-Nian, the head of the National Health Commission's COVID-19 leading task force, said that he considered the government's attached huge importance to fighting the epidemic. We have overcome 4 waves already. So that's why I want to say that steering is in place. The Hong Kong SAR government has been taking up main responsibilities. I don't fully understand what main responsibility is. Every day, I am practicing that. I am taking up main responsibilities. It also means that when the situation deteriorates and far exceeds our capacity, as the commander, as the chief executive, I have raised a request with the central government for support in terms of how we can fully utilize the resources provided by the central government. I am in charge of that. Now, in face of a major epidemic, maybe there is a room for improvement. However, like I said, every day we are learning from our experience. Every day we are trying to find out what we can improve on. For example, like the Secretary for Security said, for the Qingyi facility, some people are not happy with the meals, so we are providing them with more options. If they are bored, we are providing means of entertainment to improve the life there. So that's our attitude, and we will continue to uphold this attitude. Now, the 5th wave in less than 2 months' time, the daily number of cases have surged the total number have surged to 500,000 cases, and we have lots of death cases. I'm greatly saddened. We have to do a good job, and in order to do that, we have to have the full support of the public, like the central government said recently. The fight against the epidemic is not just a fight of the Hong Kong SAR government and the chief executive. We also need the help from across the industries and the professionals, including medical health workers, the INT industry, and so on, and everyone in Hong Kong as well. Media friends can also contribute by disseminating accurate information to the public.
The one in the middle on the front row, please. It's the last question. I'm from TVB. Just now, the secretary mentioned there are now 19,000 messages to the dedicated communication platform, but only 1,700 were sent to isolation facilities. Why is it that the other cases couldn't get into the isolation facilities? And how are you going to speed up the rate of people being sent to isolation centers, facilities? Thank you. 19,000 calls and messages received. Half of them did not provide complete information. Many actually did not make a request. As I said, they were just using the hotline to give us certain information. And here I would like to make an appeal too for people who use the hotline. Please, we want to handle urgent cases that need to be sent to isolation facilities. For others, please do not waste our resources by calling the hotline. Now, so 19,000, half did not provide enough information. There should still be 9,000 left, but how come only 1,700 are been sent to isolation facilities? Well, probably because they don't fit the criteria. As I said, we will only take in those with no or mild symptoms and those who could take care of themselves, and not all of the calls fit that criteria. And then some may want to choose a particular facility. They only want to go to this facility and another facility. But of course, we cannot entertain such requests. And that's why at the end, about 2,000, 1,700 who've been sent to facilities and 300 to be sent. So in total, 2,000 will be in isolation facilities. Now, for these community isolation facilities, we want to send those who've been infected to be sent to these community isolation facilities as possible, so they won't infect their family members and others in the community. In the past, we didn't have enough isolation facilities, so maybe those willing will go to these facilities. But now, with the isolation order, in theory, you should all go to isolation facilities. Once you receive the isolation order, you don't have a choice to say no, and we'll be enforcing these orders actively in future, because we want those who've been infected could be isolated to give protection to their family members and others. Sorry, if I may, just if you notice, tomorrow the press briefing will focus on vaccination, because vaccination is still the most effective means to prevent infection in particular and protect the elderly. So tomorrow, the Secretary for the Civil Service, who is in charge of the community vaccination program, and also the Secretary for Labour and Welfare, who is in charge of residential care homes and care for the elderly, will join me tomorrow in the press briefing. It's Friday tomorrow, so I could tell you that on Saturdays and Sundays we'll still be holding this press briefing. Thank you very much. Thank you.